The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. Today is the second anniversary episode. I can't believe we made it. Today I'm joined by Alex Volynsky. Alex is a physician assistant in oncology and also a testicular cancer survivor, so he's probably got some interesting perspectives on things. Alex, thanks so much for being here.
Yeah, thank you for having me. Appreciate it.
So let's talk about your background a little bit before we get into your testicular cancer. Working in oncology, did you ever expect, to be on the other side of it?
Great question. No, really no. I mean, the last couple of years has given me more kind of perspective. But when I started this job in oncology, 4.5, almost 5 years ago, I was like, yeah, I mean, I thought cancer was for kind of older people, and I wasn't really exposed to cancer in young people. But from my perspective, life is crazy and things can happen to really anybody. So it never really dawned on me that it could be me, but one day it did, and here I am.
Now, working in oncology, are you close at all? I know you're at Penn, so are you working with Dr. Pierorazio often, or had you not really talked to him before your testicular cancer?
Yeah, so prior to my diagnosis, so I had no idea who he was. At Penn, there's a few different hospitals downtown. We have three main hospitals downtown. He works at one of the other ones that I don't work at. So prior to my diagnosis, I had no idea who he was. The oncologist that we have at the hospital I work at, the main one, we just opened up a new one, the pavilion at the hospital of the University of Pennsylvania. We have Dr. David Vaughn who works there, and he's my oncologist. He was actually someone that I have heard about even prior to my diagnosis. And actually, one of the first things that I told him when I first saw him in the office was that there was a patient, and we'll also probably get into this kind of more detail, but there was a patient that his name was also Alex, who was seen by Dr. Vaughn. And so it's kind of come full circle. But I mean, for your question, at least, I don't directly work with Dr. Vaughn, but we do have some patients come in who are getting stem cell transplants for testicular cancer. But I don't routinely see solid cancers like testicular cancer or any kind of GI or lung cancer. I primarily work with patients who have blood cancer, so leukemias, lymphoma, myeloma. But since we do stem cell transplants on my job, every now and then we'll email Dr. Vaughn or kind of get his input, but it's not too often.
Talk kind of about your background on your knowledge of testicular cancer. When you were going through school, I mean, was it something that was even mentioned, or as a young man at the time in school, were you even aware of it?
Yeah. So I remember, I mean, even back in I think I guess middle school, elementary school, even they were always telling us, because we were boys at the time. I don't even know how old, probably 8 or 9 or 10, I guess. I don't know. And they're always yeah, it's important that you always check yourself. It's one of the most curable cancers. So I always had this I guess this knowledge, I guess that that if you catch this early, or even if you kind of catch it in later stages, it's still kind of favorable, I guess. And it's still something that's very curable. In PA school, just several years ago, I remember one of my professors would always say, because he worked in primary care, he's you always have to do a testicular exam on young guys. And that's something that you can't miss. And then when I was learning about it in PA school, again, the kind of from a big picture perspective, I always kind of got the sense that this is a very curable cancer. In my world with leukemia, lymphoma, myeloma, we don't say the word cure very often. And with testicular cancer, you do. I mean, unfortunately, there are guys that don't get that cure, but the vast majority of guys do. So I always had this notion that testicular cancer is something curable, and it's like a better cancer to have, which is what I told Dr. Pierorazio, actually. And he's I agree with you.
Yeah. So talk about when you first, so you knew about self-exams. So were you doing them regularly on yourself?
So, so sort of. So, in PA school and stuff, probably not often. I'll be honest. Like probably like most guys, they're just like maybe every once in a while. If you feel like a strain or like you feel like you pulled something, you check yourself, like whatever. But so I started actually kind of doing more like pretty routine self exams. I'd say like once a month, once every 2 months. Actually, after I met this one patient, it was one of Dr. Vaughn's patients. If there's anybody listening, I'm sure you probably also know his story. His name's Alex Bartlett. He so I actually met him, and I was maybe a year into this job, and I think this was like right before COVID, maybe like 3-ish years ago, and so he actually passed very sadly. And I remember coming home and I was like, oh my God, is this like a sign from the universe? Like his name's Alex, my name's Alex, like, and because my job that at that time, so I actually essentially discharged him to like home hospice pretty much. And I remember coming home and I was like, holy crap, like this could be me. And that was like the first time that I was like, holy crap, like this is real. Like I should be checking myself. So he was kind of like the main reason that I started kind of checking myself very often. Um, and then fast forward to 3.5 years later or whatever, and I find something and I'm like, holy crap, like I mean, the universe works in very mysterious ways.
Yeah, I didn't
Yeah.
ever know Alex Bartlett, but I know the name, and I know that Kim
Yeah.
Jones of TCAF knows him. I know that he kind of
Yeah.
passed near my like beginning of my involvement in this, but that is, like you said, crazy from the universe. You know,
Yeah.
wow. You were doing your self exams. You said 3.5 years later. What was it
Mhm.
exactly that you had noticed on yourself?
Yeah. So there's one day, actually, it's coming up on like 1 year pretty much, like about a year ago. I was at work, and like at work, we wear scrubs. So I was walking at work and I was like, I kind of feel something weird down there. It's not right. Some like a dull ache. And then I was like, oh, like maybe like my scrubs are too tight or like whatever, like I hiked them up too high or like whatever. And then so I went home and I found like that night I did a self exam and I felt something like in my left testicle. I felt like a hard like rock, like it felt like a rock. And I was like, this is not normal, like at all. So I paused, I stopped, and then actually like I think a week prior I was biking and I was like, oh, maybe it's just like a bruise from biking, like whatever, just like sitting in the seat, it's no big deal. And then I checked 24 hours later when I got home, like the next night, and I was still there. And that's when I was like, okay, I need to do something about this.
So then, having known Alex Bartlett and knowing that you had sent him home on hospice, and then feeling this now on yourself, like what kind of emotions were you feeling?
A lot, a lot. So so that was like the first thing that I kind of thought of it. And I mean, even kind of more so, like, I guess, like after my ultrasound, like when I first read the ultrasound results, like when my provider called me about it, the first thing I thought of was like Alex. And I was like, I mean, his life meant a lot to obviously his family and his friends, and like also to me, some random person that I guess we were just destined to meet. So, I mean, I like when I first read the ultrasound results, he was the first person that I thought of, and I was like, I think maybe the reason that we met was for me to find this early and like for me to have like hopefully like a more favorable outcome. And like I cried, like I was like I shed some tears for sure. I told my wife, and she cried with me, and then we're like, okay, like let's get down to business, like let's fix this, like let's go, like like there's no time to wait. So we just proceeded ahead with with like surgery and treatment and everything.
Yeah, I mean, we talk a lot about testicular cancer being 95% curable, but having that personal encounter with that one of those 5%, that must have been tough.
Yeah, yeah, it was tough. I mean, like, yeah, I mean, he was very special. Like, I mean, even though I met him and I took care of him just probably for a couple of days. Yeah, I mean, he certainly had a major impact on my life. And yeah, yeah.
So let's talk about, you had your ultrasound, and then what was the story like for you from there?
Yeah, so I remember the ultrasound. So I got it done like on a Wednesday or something, and then like the turnaround time was actually pretty quick. I think I got the results like 2 hours, 3 hours later or something. And then I was actually downtown. My wife was down at the vet with my dog. And then I remember telling her when we were both like there in the parking lot, and like she kind of broke down, I broke down and everything. But then she's like, okay, like, we need to fix this. And, this is a curable thing, like, for the vast majority of guys. So she actually, she gave me the idea, and I think it was like late in the day, and like me being in medicine, I kind of know how things work. So like, you kind of have to get your calls in like on the earlier side, because after like, 4 or 5 o'clock, everything's closed, and you wait a day, and then you get delayed by like more days and like a week and whatever. And so my wife was like, yeah, on the way home, like we should just call like the number for urology, because my provider, like it was my PCP who ordered it, and she's like, okay, like, here's the urology number if you're interested in calling, but they'll call you within 2 business days. And I'm like, no, like I'm going to pick up the phone and just call them now. There's no harm to doing that. And that's like what I would advocate for other guys, is to really kind of like speak up and try to like facilitate things like on their end as much as possible. And so anyway, so I called the urology number. They got me in actually the next morning to see Dr. Pierorazio. Of course, me being like the medical like and very anxious nerd that I am, spent the rest of the afternoon just kind of reading kind of online about testicular cancer and kind of the treatments and like, the different subtypes, kind of like refreshing my memory and stuff about that. So then I saw Dr. Pierorazio in the office the next morning. I told him, I was like, I know this is probably cancer. And he's like, yeah, like over 95% chance, So things kind of moved pretty quickly afterwards. I had my orchiectomy it's like 5-6 days or something after I saw him. Things went pretty smoothly. I mean, as much as I can. I was sore for a couple of days, needed like help shower like the first time or whatever, but overall tolerated, I guess, okay. And then my results came in like a week, 10 days or so after. He called me with the results, and it was also, again, like when I was at work, and he talked me through the results and then got me set up with Dr. Vaughn, and then got in to see him like 2 weeks or so after.
Just a random question, but when you're at work and he calls you, does he call you on your cell phone or does he call you on your work phone?
Good question. Yeah. So it was my personal cell phone. Yeah. And it was, so it was very, I guess, annoying for me, because I was very busy with patients, and like, I was like, damn, like, it was a Friday afternoon, and I was like with a sick patient. I'm like, all right, like, do I take care of my patient? Do I pick up the phone? Do I do both? Like, is there a way to do both? Like, but yeah, so like we talked just kind of briefly, and things kind of like went forward from there.
In your position, do you have access to your chart maybe even before like it would get to kind of the patient portal?
Sort of. So yeah, so we have the portal, and like the app on my phone and stuff. So the results are posted sometimes before that, sometimes before doctors and like providers can like review them and everything. So that's the only access I have. What I don't do is like go into my own like physical chart and like Epic in the medical record, because I think they would probably fire me for that. I think that's like a no-no, but which is a separate topic. But I don't also understand that either, because you can read everybody's notes on the app anyway. So that makes no sense to me, but it is what it is.
Interesting. Okay. So after he called you with the results, like what were the next steps that you guys discussed?
Yeah. So he said, like next steps, he's like, the main thing is that we're going to repeat labs in like, I think 2 weeks or something from the orc. And he's like, the main thing we want to see is that the numbers are going down and hopefully go down to 0. Like just for reference, like my HCG, I think at diagnosis was like 400 or something. And then my AFP was normal. And then, so we repeated labs. That was the next step. And then he got me plugged in with Dr. Vaughn. He did like all the consult and everything on his side. And then this was another time when I was like, okay, it's Friday afternoon. It's like 4 o'clock. I'm going to pick up the phone and call the coordinator for our like new oncology like patient like visit. So I called them. I'm like, hey, like, can I get plugged in like sooner rather than later? If you guys have like openings and stuff. So they were able to work some magic, got me in like 2 weeks, which I think is like pretty standard. And then I saw Dr. Vaughn, met him. And then I was like, I've heard a lot about you. I've taken care of some of your patients. I actually told him about Alex. And I was like, kind of deja vu, weird, like, because I have taken care of some of your patients. Like, this is just very odd, but I felt very comfortable with him.
Yeah. So I know that you opted for the primary robotic RPLND. What kind of
Yeah.
led you to that point?
Yeah. So essentially when I met Dr. Vaughn, um, so so it was interesting because on my first CAT scan, and this is kind of I guess like medical talk for anybody like interested, but I think it kind of brings up a good point. So my first like staging CAT scan of my abdomen showed that like that there was like a few lymph nodes that they were like kind of questionable. They were like between 1 and 2 centimeters. So in like an otherwise normal person who hasn't had a CAT scan before, like in that area, I think that like doctors and providers probably say, okay, like there's probably cancer there, right? But interestingly, actually, for me, when I got into PA school, I had pancreatitis, and so they did a CAT scan of my abdomen, and I brought those results in with Dr. Vaughn. So I brought in the actual images, and like just for anybody listening, like another like thing that I would say is like, like for prior CAT scans, imaging, like biopsy reports, all of that, that's very important. Like especially when you're bringing like if you like if people bring that into like new providers because it really helps with making decisions. Because if I didn't bring it in, then they would ask me for it, things would get delayed, et cetera, et cetera. But so I brought those in, and turns out that the CAT scan from like 7 years ago or whatever when I got into PA school um, was like the lymph nodes looked the same. Like so, Dr. Vaughn pulled it up. He looked at the images like on one side of the screen, the new one on this side of the screen, and he's like, the lymph nodes are the exact same. And he's like, I can make two conclusions. One is that you did not have testicular cancer like whatever 5, 6, 7 years ago, and number two, the lymph nodes look the same. So for him to kind of say that like that was like kind of like more reassuring for me. But he's like for us to kind of be on the safe side, like let's like repeat the scan in a couple weeks. I think I repeated it 4 to 6 weeks later with repeat blood work, just kind of make sure my staging was correct. And I remember Dr. Pierorazio always telling me, it's like, it's more important to get the diagnosis right and the staging right than it is to like risk over or under treating you, which I agree like with like 5,000%. Because I feel like some doctors sometimes kind of rush into things, and that's kind of when you run into like over treatment and everything. But I mean, for my team, they were able to kind of get the diagnosis right. And then essentially Dr. Vaughn, he kind of presented me with three options, and I kind of knew the options just like being in the medical field. And it was either one cycle of chemo, surveillance, or RPLND. And I kind of was like, well, you know, like just kind of to take a step back, it's a very hard decision because it's like those are the three kind of main things that like that we use to treat testicular cancer. So how I saw it was like, I think the main thing that it came down for me is like, if I were to choose something right now, and if the worst thing happens, like with like, like in terms of relapse, like, am I going to be comfortable with that down the line? And like my other concern was also over treatment. So I was like, well, 50-50 shot that I would, if I get one cycle of chemo, I would live the rest of my life not knowing like if I overtreated myself, if I needed this or not. So, and me kind of being like the technical kind of like more kind of, I guess, like data driven person, I was like, for me, more data is better, and that helps me make decisions. So, out of all of those, like the RPLND was kind of the best bet because that gives you like accurate staging. It says like, you take all of these like lymph nodes. It tells you like, were they positive, were they negative, like how many, and then you can make further treatment decisions from that. But it was a very, very nuanced, like very complex, like decision.
Yeah. I mean, it seems like a tough decision for somebody who doesn't have the medical background, but maybe with that history, like in your head, maybe that helped. I don't know. Maybe was it a difficult decision or?
For sure. Yeah. Yeah. I mean, like, yeah. So for those three options and just kind of like the talk through, I guess, like my decision-making process, like, so I was kind of ranking them in like order. What I didn't want was active surveillance because I knew that like that would mean labs and CAT scans very frequently. So the labs are fine; you get them like every like 2 months or whatever, and like that's fine; it's no big deal. But the CAT scans, I think it was like every 2 to 3 months, and I was like, well, if I have a 50 chance of relapsing, then I'm going to give myself all this radiation over like potentially like a couple months or a year or 2 years, couple years, and then need chemo down the line, right? And when and like me know in the medical background, we know that like you combine radiation, like more so like real radiation, like kind of like what's used for seminoma, and not with CT scans, though with CT scans there are radiation, obviously. Like if you combine chemo and like radiation, that really increases your chance of like secondary cancers like down the line. Um, and like it actually increases it more than like either of them alone is like what the data shows, at least like from like what I understand. And then so like with that, I was just not comfortable, and like my wife was pregnant at the time. She was like a couple months, 3 months, 4 months or something, and I was like, well, worst case in my head is that like I would relapse like either when she's pregnant or when she's about to give birth, and like I was like, oh my god, like if I need chemo, can I even be near my daughter, like or like my child, because we didn't know the gender at the time. So I was like, that's like out of the question. Like that's too much uncertainty for me. And so then I thought of chemo, and I was like, well, one cycle of chemo doesn't sound terrible, but also like 50% chance I'm overtreating myself. And if I never relapse, if I take one cycle of chemo and never relapse, then I'll live the rest of my life knowing that there was a 50-50 chance that I overtreated myself and gave me all the side effects of the chemo for no reason. So, and then in terms of the RPLND, I was, well, this is a major complex surgery. I wouldn't trust like any kind of run-of-the-mill surgeon to kind of do this. And then with Dr. Pierorazio, because he trained at Hopkins, and he was trained like in the robotic approach. He does it open as well, just like the normal kind of like the larger like midline incision. And I was, well, I'm at a high volume center for that. And when I talked to him, I was like, listen, like, am I like a good candidate to kind of like do it robotically? Because it's left sided. We know left sided is more likely to go to the left and not the right. Just because like how the anatomy works. And he said, yeah, like you're like the ideal candidate for this, and like in terms of like the cancer outcomes, like it's at least short term wise, like we know, like not just like 2 years, but like 5, 10-ish years, like we know that the outcomes are pretty identical with like open versus robotic. And I was like, all right, let's do it. Like, it's so yeah, so we went ahead with that, and yeah, it wasn't as bad as people say, but it was uncomfortable, but it wasn't terrible.
Yeah, talk more about the robotic RPLND, because I think, and I apologize if I'm forgetting anybody else, but I think the only other person I've talked to on this podcast that's had the robotic was the Olympic swimmer Nathan Adrian.
Oh yeah.
So if you can shed any more light on what that experience was like for you?
For sure, yeah. So there's probably multiple ways to do it robotically. And at least for my case, since I had it like on the left side, I don't know if that like matters from like a surgical perspective, but the incisions, like, so I have six smaller incisions, like each of them are like I think the largest one, I don't know, like 4 centimeters maybe. I have six of those kind of on my lower abdomen. It's still higher up than my the orc scar, and like one is like right like on my like belt line, I guess. And yeah, like so the actual surgery, once I woke up, I felt pretty good, and Dr. Pierorazio was like, "You can go home tonight if you feel up for it." But then, of course, the anesthesia wore off, and I felt like crap, and I was like nauseous and everything. But then, but fast forward to the next day, I was like walking. They took my Foley out, like my catheter out, and I was walking. I was like eating, and I went home. But like kind of from a global perspective, I felt pretty good in the hospital. I mean, obviously you had surgery, but with all things considered, I actually felt pretty good, and I was discharged home like under 24 hours from when I came in. And then, but like the post-op kind of course, and they told me like, it's normal to have swelling, kind of like especially around that area where the incisions are, and like also in your scrotum. And that's, for me, that was pretty severe, I guess. Like, so there was pretty severe swelling down there, and also kind of like, and my like and one of the incisions like kind of like got bruised up and it went into like my hip and my like thigh, which isn't that abnormal. Obviously, you're really like moving the robot, and like the robot arms around, like you're going to cause tissue like kind of damage. And it was just like, it was more so discolored than anything. It wasn't like painful. It wasn't like truly it wasn't like actual pain. Pain was just more like discomfort and just like annoying. And the same thing with the swelling, because for a couple of days at home, I was still okay, but then like I'd say like 5 to a week, like 5, 7 days later, like the swelling kind of got really bad, kind of down there in my scrotum, and it was just uncomfortable. I wasn't really taking Tylenol, I wasn't taking Advil, I wasn't taking like oxycodone or anything like that. I kind of felt bloated, still able to eat kind of lightly and everything. And then I think like a week later, kind of when I thought it got at its worst, I asked for an ultrasound, and I was like, "Is this reasonable to get? Like, just make sure we're not missing anything, like whatever." They're like, "Yeah, sure. Like, you can get it." So I got one. It just showed fluid, which is like normal after surgery. And I talked to Dr. Pierorazio at like late on the Friday, and he's like, "Go home, take Advil, take Tylenol, really like ice it, elevated, all that kind of stuff." And then then a couple days later, I started going down. And probably like at 2 weeks post-op, I felt pretty good. I was like, even like 3 days later, 4 days later, I was doing things on my own, just like showering, I'm making my own meals and stuff. Still needed some help just to make it easier for me, but overall, I was feeling okay. And then 2 weeks later, 3 weeks later, I think I started jogging at like the 3 week mark. Um, and then yeah, I think at 4 weeks I went back to work. I don't have a really like physical job. I mean, all I do is walk around, sit, stuff like that. But I was back to work at 4 weeks. I felt normal, and then I started running again and started working out again. Like I was taking it easy kind of for the beginning, but I mean, I felt like better than like before. Like, and that's like a pretty major thing to say, especially after having a surgery like this. But yeah, the recovery was like it sucked in the beginning, right? But overall, like it wasn't terrible.
Yeah, probably peace of mind was probably making you feel better too.
Yeah, yeah.
Now I know you conceived before the surgery, but is there any risk? I'm not sure how the risks compare between RPL and or robotic and open. I know with open, there's the risk of retrograde ejaculation. Is there the same thing with robotic? Because I know that Dr. Pierorazio is one of like the top doctors in the country for these surgeries anyway. So maybe he's just good at not doing that either way, but.
Right. Yeah. So for either the robotic approach or open, they both actually carry the risk of retrograde. What I don't know is like if one is higher than the other, but like it like kind of from like a medical perspective, it matters more so about like if it's nerve sparing or not. You can do a nerve sparing approach with robotic, and you can do a nerve sparing approach with open. You can do nerve sparing if you do it one side or like both sides. Doesn't matter, post chemotherapy or like primary, like meaning like pre chemo. So like for both surgeries, it carries the risk just because the lymph nodes that you're taking out, they're very close to like all the nerves that kind of control like all those functions. But yeah, sort of kind of like to your point, like especially if you're getting this in the primary setting, like without chemotherapy, kind of beforehand or even post chemotherapy, it's really important like to find like a surgeon that is very well trained in the nerve sparing approach. I mean, it's a major thing, right? Because it can definitely affect fertility, obviously. And yeah.
So yeah, we mentioned that you conceived before. Did you bank sperm?
I did. Yeah. Yeah, it was like, I think even when I met Dr. Pierorazio the first time, like in the office, like I met his whole team and everything, like the fertility specialist and stuff too. I was like, great. Like, can I go like later today? Like it's like down the street. And I think I went the next day. Yeah. So there were a few sessions, whatever that I went, and just kind of on the off chance that I would get it.
And having had what I think you said is your daughter now,
Yep.
Is this something you're going to like keep in storage, or is that something you're going to stop paying for?
Yeah. I mean, like for me, like like for some patients, like maybe most patients, like it sort of kind of comes down to money and like insurance and stuff. But I think I paid $200 a year. I'm fine paying that. Just like like we certainly want more kids, 2, maybe 3, but for now, one's enough. But yeah, for sure, I'm going to keep it stored. It's not bothering me. It's there. It's frozen, and if we need it in the future, we'll use it.
Perfect. Is there any other advice that you want to give to somebody like at the different stages? Maybe somebody's listening to this that, they just felt a lump or something and they found this podcast when they were Googling. And then after that, somebody who's just been diagnosed. And then after that, somebody who has kind of been put on surveillance.
Yeah. So the few things that I'll say is like, so like there's actually I think one of the oncology coordinators, like when I actually called and like try to make an appointment, I remember because it was late on the Friday there, the first thing I said there, I was like, sorry for bothering you, like on late Friday before you guys leave, but I'm trying to move this up. So essentially what I would say to patients is like, really to be like your own like best advocate. Because that's what the coordinator told me, pretty much. And she's like, you have to be your own like best like self advocate because no one else is going to advocate for you as best as you can for you. So I mean, even if that means kind of like pestering a little bit, like your providers and like care team in terms of like maybe getting things scheduled, try to move it up. There's no harm in that. You know what I mean? Like, and like that shows your providers that you care about yourself, you care about your outcome. And I think that's probably like the most important thing. And I guess like the other thing that I'll say is like, in terms of like follow up and everything, like, you hear all these stories like online where guys like just, they don't follow up or they go for a couple like weeks, months and then say, oh, I'm fine. But yeah, I mean, like you'll probably be fine, but like, it's really important to go to your appointments and to like follow through with all like the schedules to kind of, get CAT scans if you needed to get labs like every so often. And like, that's very, very important. And then I guess like, yeah, one more thing, just from like a big picture perspective, like, I mean, like there hasn't been a day that's gone by that I haven't like thought about this and just being a testicular cancer like patient, but like, this is like overall it's a curable thing. This is probably not something that's going to kill you. There's going to be road bumps. There's going to be like, there's going to be hiccups with everything. Just that's what life is. But, it's really important to find a like really good care team, like a high volume center if you can. Cause that, that's definitely going to give people like the best outcome.
Great. And then I know you mentioned in the beginning, kind of, you were doing like reading online and stuff. And I know that recently, maybe my phone has known that this has been in my calendar. So it's been like showing me your comments, but I've seen comments in the testicular cancer support group on Facebook. So was that something that you found before, during, or after?
I think that was probably, like I guess like during or like maybe like right after like the first visit that I had with Dr. Pierorazio. So like I would say I'm fairly active. I'm always like happy like to answer questions, and if anybody's like ever listening, I mean, like I guess like the medical disclaimers, I can't give you like definitive medical advice because like I don't know all the details about your case. But if if anybody listening ever wants to like shoot me a message, like I'm more than happy to respond. I'm happy to talk about this. Like I'm a very open person, I would like to think. So, anything is kind of game, and I'm very reachable.
Cool. And then I know we talked about like the chart, like app on your phone and stuff. There's one rule in the support group that like, there's kind of a lot of back end discussion within the admins, like posting official medical results. As a physician's assistant, like what are your thoughts on that in the support group? Because I know some people will post it and then it'll get deleted and maybe it kind of is off-putting, but like, what are your thoughts on that?
Yeah, I mean, like, so like one thing that I noticed is like for some people when they post it, they actually like they will like blur out their like name or like their like MRN or like their like date of birth or like whatever. I don't know. I mean, I have like mixed feelings about it. I mean, like the main thing that I think is that like for people like on Facebook and all these other different like forums online, like they shouldn't rely on that as medical advice, obviously, right? Like because they're just strangers on the internet, and like who knows, like maybe it's like a fake account, like I don't know, but like the it's not wrong to get like second opinions, and like the role of a support group is to like talk to other like people and survivors and like caretakers about like, hey, like I'm going through this. Is this like similar? Like, is this like similar to other people's stories? But like, I feel like, the main person or the main people that like should know you as a patient is like your doctors, your physicians, your providers. Yeah, but I mean, like sometimes I browse if somebody posts something, I read it, I'm like, oh, that's interesting, or oh, that's boring, that's probably nothing. So
Yeah, I think I'm of the opinion, like when people post their results, like, definitely don't take it as medical advice. That should be like the main thing. But I think that the hive mind is kind of good, especially if they're in the middle of nowhere and like they don't have the Dr. Pierorazios or the Dr. Carries or the Dr. Brigodias like at these high volume centers. So like maybe somebody could comment and say, I had something similar and I did this, talk to your oncologist about that. And maybe their oncologist doesn't know about that. So I don't know, but it's a slippery slope.
for sure, yeah, yeah. I mean, like for your point, for sure. I mean, like actually, like right before we talked today, like there was somebody I think who posted in the Facebook group. They also live in like rural Ohio or something, I think. And I was like, hey, like here's like a list of like all the high volume centers in like Ohio and the neighboring areas and stuff like that. You're right, because like not everyone has access to high volume centers, and like they don't know. Like, and some urologists like see testicular cancer like once in like their career, a couple times in their career. So you're right, like, that's like when it's really beneficial is like if somebody posts and say like, hey, like this seems like testicular cancer, you need to like reach out to like other high volume centers, because like that can like really save people's lives.
All right, where can people find you if they want to reach out and ask questions?
Yeah, so I guess they can. I mean, I'm always active on Facebook. I'm sure like you probably have my name somewhere here. If not, like we could probably post it with the show notes, but they can always contact me through Facebook. And yeah, I mean, happy to talk to them. Happy. Like there's actually there's a friend of like now like a friend that I actually met through the support group. He's very similar like subtype as me, got the same surgery as me. Like we're not friends in real life, like our wives are friends. And so yeah, I mean, like for testicular cancer, it's like it's a small community, so like we should all like look out for each other. But yeah, if anybody ever wants to reach me, they can reach me on Facebook. Happy to take messages, talk to them, anything really.
Cool. And this one's going to come out after the conference, but I think I saw that you registered. So we'll pretend that we met and it was great. And we laughed, we cried, we had a lot of fun at the social. So thanks everybody who's listening that came to the conference. It was really fun. Hopefully, fingers crossed. I'm sure it will be.
Yep.
Alex Volynsky, thank you so much for being on It Takes Balls.
Yeah. Thank you for having me. Appreciate it.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.